My name's Lisa, I'm a pharmacist. I'm going to talk you through how to use one of the most common types of inhaler, which is the MDI inhaler. And this is composed of a cylinder which contains the medication and a propellant in the aerosol, which sits inside the compartment. And there's a cap which covers the mouthpiece here. So if it's the first time that you're using the inhaler, then it's important to prime it just to ensure it does work. So give it a shake and just push down to release a dose into the air. So as you can see, there was a fine mist that was released, which indicates the device is working. So to actually inhale a dose, you would firstly need to empty the lungs of residual air and therefore exhale out of the mouth first of all, but not into the inhaler device. Just hold that away from you. So like this. Then you would make a tight seal by putting the inhaler in the mouth and closing the lips tightly around the mouthpiece. I will show you the full technique once I've talked through this. And then once you've made the seal with the lips, you would then start breathing in, push the canister down to release a dose, and continue breathing in nice and slowly and deeply, and as far as you can go. Then remove it gently from the mouth and hold the breath for 10 seconds or as long as is comfortable, to make sure there's no escape of the dose and that the medicine gets down into the lungs. And if you do need to inhale a second dose as prescribed, then just repeat this cycle after about 30 seconds. So I'm just going to demonstrate that technique. So we've removed the cap from the mouthpiece. We're giving it a good shake. We're going to exhale first. And then just continue to breathe normally and replace the cap over the mouthpiece. And if you need to deliver a second dose, wait about 30 seconds before repeating the process. And in order to clean the inhaler, you just need to use a dry tissue around the mouthpiece and then store it in a cool and dry location. Some MDIs do have a counter on the side. I do have another device, similar MDI device, however this one does have a counter device on the back of the inhaler which indicates the number of doses that are left. Each time a dose is delivered, this should decrease by one number. So just to demonstrate that, we're on 123 at the moment. If we deliver a dose, this then has taken the dose down to 122. So that's helpful for knowing when you need to get a repeat order of your inhaler to make sure you're not inhaling from an empty device.